to the fourth meeting of the Senate Judiciary Committee. It's now 9:10. Mentioned to the member that we were going to go ahead and start at 10 after, just in case he can make it. Do any members have any guests that they'd like to introduce? Seeing none, all members, we just ask that you silence your phone. And if you could, Mr. Secretary, please call the roll.
Senator Carroll. Here. Senator Deneen. Here. Senator Neal. Here. Senator Nemes.
Present.
Senator Reed.
Here.
Senator Stivers. Senator Thomas.
Here.
Vice Chair Wheeler. Chair Storm.
Here. It appears we have a quorum duly constituted to do business at this time. First on our agenda is Senate Bill 125, an act relating to juvenile justice, sponsored by Senator Danny Carroll. Senator Carroll, if you could introduce yourself for the record and your guests, and you have the floor.
Good morning, Mr. Chairman, committee. My name is Danny Carroll. I'm the state senator from the 2nd District.
Randy White, Commissioner, Department of Juvenile Justice.
Mona Womack, Deputy Secretary at the Justice and Public Safety Cabinet.
Thank you. Senator Carroll, I'd noticed that there's a committee substitute on the measure. Would you like to go ahead and
Yes, please.
adopt that?
Yes.
So at this time, I'd entertain a motion on the sub. I'll make the motion on the sub. We have a second on the sub, Senator Thomas. All in favor say aye. Any opposed, say nay. The committee substitute is adopted. You may proceed, sir.
Thank you, Mr. Chairman. Senate Bill 125, as amended, this is not a new bill to anyone on this committee. This is the third year that we have put this bill up for vote, and it has passed this committee twice in the past. And I'm not going to go over every detail of the bill. Just in general, if you all remember, it sets up the structure for evaluation and placement of acute mentally ill kids. And it sets up a continuum of care, how to move the kids up and down the system based on their need, sets up a system where both cabinets are involved, and if there are discrepancies on the placement, a judge would be involved to make the final decision. We have worked with all the stakeholders, both cabinets, AOC, Kentucky Hospital Association, several groups, and we have made some tweaks on the bill this session. What I want to do is just kind of go over a few of those. To begin with, if you have your copy of the committee sub out on Section 5, sorry, Mr. Chairman. There was a section within that aspect of the bill that had to do with confidential information. Should there be a juvenile that filed a suit where that juvenile's information would no longer be confidential, and we did remove that language from the bill. Also in Section 5, any information that is publicly released related to an escape, we added a provision on that information shall be removed from public access immediately upon request of DJJ once that juvenile is taken into custody and is returned to the facility. Also on Section 17, it allows with the juvenile that is absent without leave from a DJJ facility where they may be charged with escape on that. And then finally, Section 26 is additional language, and it has to do with the aspects of the bill where a juvenile is within a mental health inpatient psychiatric hospital or teaching hospital. There are a couple aspects of the bill that would allow for that juvenile to be removed if they become violent and are assaulting staff members. And we had some concerns about those two particular paragraphs in the bill, that if we change that system now without having the acute mentally ill juvenile detention center in operation, feared that it could create some problems where we have more high acuity youth that are perhaps in DCBS offices or in detention centers, and probably in most cases not the best situation. So we felt like that we needed to adjust the language basically to state that an inpatient psychiatric hospital or pediatric teaching hospital shall not refuse admittance of a high acuity youth for inpatient treatment under subsection 6 of section 1, or discharge a high acuity youth from an inpatient treatment under subsection 8 in section 1 of the 8 until the construction of a high acuity mental health facility required under section 23 of this act. And again, this is not to be construed to require an inpatient psychiatric hospital or pediatric teaching hospital to admit a child if doing so would be a violation of federal law. So those protections are there. And I would also note that under this, that any assault that might take place within a facility, this does not preclude any victim of assault from taking a petition on a juvenile at any time. So I wanted to make that clear, but we felt like we needed to add, we didn't want to make the situation worse without having the mental health detention center as the highest level of the continuum of care, which would be these most violent kids that are high acuity mentally ill. That would be the next step for them. And rather than them being taken down in the continuum of care and put in a placement in whatever facility or even within a detention center, which would not be the best scenario for them, we decided to add that language. And Mr. Chairman, I'm going to stop with that, and I'm going to let my guest here with DJJ go over the PowerPoint, and this will address the acute mental health treatment facility that's proposed, and also the 2 female detention centers that you all have heard me speak about in the past.
One moment. Senator Thomas, you had a question. You want to ask it now, or do you want to let the presentation proceed first? Okay, thank you. Thank you.
Thank you. Thank you for allowing us to present to you today. Again, I'm Mona Womack. I'm the Deputy Secretary at the Justice Cabinet. We have a PowerPoint that I will try to move through pretty quickly so that we have enough time to answer any questions that you may have at the end. As Senator Carroll mentioned, this bill is before you is one that you have seen a few times. Among other critical need provisions in the bill, such as 2 new additional female detention facilities, this bill calls for a facility to be built specifically for youth in detention who have severe high acuity mental health needs, allowing them to get the appropriate care they need at a secure state-run medical facility. Senate Bill 125 fills a gap in services for youth with significant mental health issues who are violent, where private options for private care are limited, and juvenile detention simply is not the appropriate setting for this specialized secure care. Okay, why do we need this facility in Kentucky? As I'm sure you are aware, if a judge orders a youth to detention, DJJ must take that youth. We have no option to decline. And this is regardless of what the youth is charged with. So whether he or she is charged with truancy for missing school or for murder, DJJ must take that youth into detention. Unfortunately, some of these youths have severe mental illness that render them extremely violent. The department simply does not have the means necessary to have any chance of providing proper treatment for these kids, and that's what this bill fixes. As with any youth who suffer an emergency medical crisis in detention, an uncontrollably violent youth needs to be in a hospital receiving treatment. I think we would all agree that a youth sitting in a cell in detention who has an acute appendicitis attack, for example, should be taken to a hospital for medical care. We would not leave that youth sitting in a jail cell because the correctional officers who work there simply are not trained to treat an appendicitis attack. And severe mental illness is no different. Detention centers are not psychiatric hospitals, and they were not built and are simply not equipped in a way that allows for proper treatment and management of a seriously mentally ill, violent juvenile. The other reason that we need this facility in Kentucky is because private psychiatric hospitals are not required to accept DJJ youth. They routinely refuse to accept these youth, or they prematurely discharge them from care because of their assaultive, violent behavior, which unfortunately often results in injuries to hospital staff. And finally, these youth require a disproportionately high number of staff, of time, and resources to ensure not only the safety of that youth, but also the safety and security of other youth who are in detention and of our staff. These youth endanger the rest of the population if you just let them mix in with the other kids. And so really the only other alternative that DJJ has is to put these youth in isolation. So it really is an impossible situation. How does the facility solve the problem? A dedicated facility would provide access to behavioral and psychiatric care for these kids. The facility is specifically designed and built for the task of providing specialized treatment. More importantly, the facility creates better outcomes and improves the possibility of a promising future for youth in the care of the state. Who does this facility serve? The facility would serve, can you go to the next? The facility would serve youth who have been determined by a clinical professional following a behavioral assessment to need a secure treatment environment and specialized services. These are kids who are a safety risk to themselves and to others in detention, and they, as I said, require a high level of psychiatric care. Can we go to the next slide? Kentucky needs this high acuity medical and mental health facility for our youth. I think you all have heard and remember the case that was repeatedly in the media and discussed in prior legislative testimonies of one particular youth, DB, who undoubtedly would have greatly benefited from access to this type of facility. This youth, if you will recall, was ordered detained by a judge, and DJJ had no choice but to obey that order, even though she suffered from severe mental illness. In all fairness to the judge, they really had no alternative to detention because she was extremely violent. So to protect their community, the judge had no choice but to order DB into detention. But that being said, detention for her only exacerbated a deterioration in her mental health. She was a danger to herself. She was incredibly violent with our staff and property. We actually had several staff quit working at DJJ, quit their jobs because they just could not deal with this. We tried 9 different times to place her in a psychiatric hospital. We tried in-state, we tried out-of-state. Each time she was either refused admission, primarily because of her aggressive behaviors. Most psychiatric hospitals will not accept a youth who has aggressive behaviors. And her self-harming behaviors were an issue as well. In one instance of many where she injured others, she barricaded a nurse's door, assaulted the nurse who was seriously injured, and we ended up having to bring her back into detention. DJJ was harshly criticized for putting her in isolation while she was in detention. But truth be told, DJJ really had no alternative. She attacked and hurt other juveniles, or she would hurt herself when she was having psychotic episodes, and she was not isolated. In short, because she was a juvenile, she could not access critical and much-needed services for her behavioral and mental health needs. We truly were fearful for her safety and the safety of others in the community when she turned 18 and we were going to have to release her from detention. So a week before she turned 18, we filed a petition for involuntary commitment to a Kentucky mental hospital, and we alleged that she was mentally ill, a danger to herself and others. Thankfully, the court and the clinicians who examined her agreed, and she was admitted to a state psychiatric hospital where for the first time in her life she received beneficial treatment. It really is a shame, though, that she could not access that kind of treatment until she became an adult. If a high acuity mental health facility had been available to her as a youth, she and others would likely have been spared years of turmoil, distress, and harm. How does this facility meet the needs? This facility allows for a certainty of placement. It would be a secure environment like a detention center, but it would also have medical and psychiatric resources that would allow for the department to adhere to clinical requirements to the Kentucky statutes and would incorporate a trauma-informed design. A dedicated facility would allow youths to be treated by a variety of mental health professionals and clinicians in a medically equipped setting that simply cannot be replicated in our current detention centers. And such a facility would help keep other staff and clinicians safe. Okay, our next slide is the design of the facility. The way this facility is proposed demonstrates that you can have security measures like what you have in a juvenile detention that can be balanced and also complemented by clinical spaces while meeting all the statutory requirements. So this facility, as we propose it, would incorporate an innovative design for movement of the youth, sight lines where they can be seen, placement of central hubs for clinical services so that we can have efficiency, safety, and security during their stay. While one or two other states have implemented similar mental health facilities for youth in detention, Kentucky is proposing a building that would serve as a leading national model in best practices for juvenile rehabilitation. Senator Carroll, do you want to? Okay, that's our presentation on the high acuity center, but I just want to move right into the two new juvenile, and this will be quick. As I said, we are proposing 2 new female detention centers. This facility would serve, the reason we need this facility is the number of girls entering juvenile detention has steadily increased since January of 2024. In order to meet the requirements this legislature passed to move toward a regional detention model, we would need to return to the regional model as soon as practicable. We have to maintain separation, if you will recall, for high and low offenders, so serious, not serious offenders, males and females. And we simply cannot do that with our existing facilities. But if we had 2 new female detention centers, we could move back to a regional model, which of course everybody, including the department, wants to do. Go to the next slide. Why 2 female facilities? Well, housing the females in each region of the Commonwealth would require significant construction projects at all 8 of our existing juvenile detention centers to be able to maintain those separation requirements I just mentioned. We are, though, working. We're currently working on facility projects in Fayette County, Linden, the area of Louisville, McCracken County, and Breathitt, our detention centers there. The female youth, as you probably know, are all separated. We house them all at Boyd County, but we need that facility in Boyd County to put males back in there. And currently, the retrofit that we have, it just doesn't, as I said, it just doesn't have the additional capacity required for male-female facilities. So, in summary, I told you I'd be quick. I hope that I did. I know you all have heard this many times before. We know that the high acuity center can balance and complement security measures. We can keep those youth secure, but also provide clinical support spaces. That's why this facility was proposed in the 24 regular session, and we believe why the Capital Planning Advisory Board, which, as you know, was comprised of members of all 3 branches of government, recently recommended funding for these facilities. We're hopeful this legislation and the request to fund these facilities will pass both chambers. We've worked very closely with Senator Carroll. We appreciate his help because I think we all believe this is the right thing to do. Thank you for your time, and we're glad to answer any questions that you have.
Thank you for your presentation. Senator, do you have any final comments before we start taking questions?
Mr. Chairman, just as those that weren't here back in 2023, when we came into session that year, there was an immediate crisis within our juvenile detention centers. There was riots. There was a young lady that had been raped. We had this young lady that was just spoken of, and every member of our caucus of the legislature was appalled and angered by what was going on in our facilities throughout the state. And when I came into session, myself and Representative Kevin Bratcher were tasked with chairing a working group to solve this solution, to get a plan together, to put DJJ back together. And we spent a lot of time, a lot of meetings with a lot of different stakeholders putting together Senate Bill 162, which was the first step. And since that time, we've had a new commissioner, new secretary, and they have done a great job in dealing with most every issue that we had during that time. The two major issues that remain, this bill addresses. So I would remind you that back when this happened, it was on us to fix this, and that's what leadership within the Senate tasked me to do as a representative from the Senate, and this is the final major piece of that. We have addressed within DJJ, the commissioner, secretary, and staff have done an excellent job, a lot of staff turnover, policy, training, you name it, and they have done what they were asked to do. This is on us. This is a step that we need to take to finalize this. It's the right thing to do first and foremost. You all have heard the stories. Some of these kids are still in cells, and we cannot continue to do that. There's civil issues, liability. There were suits that were filed as a result of what happened that year. And something I would also remind you, we are under investigation by the Department of Justice. And I know for a fact that they ask about this bill, specifically the mental health facility, on where we are with that. This could very well make the difference as to whether or not we are issued a consent decree and we're forced to do it, or even more, or we're not under a consent decree. So this is probably our last opportunity to step up and do this on our own. I really don't think it'll be another year before DOJ comes down with a decision. So I just wanted to add that. A couple questions from the last time the presentation was made. It was a day that I could not be here due to family issues. This facility, again, serves the most severe kids that we're having the most problems with. And understand there was some talk about the numbers. All kids will be assessed. And obviously, we want to come up with the proper placement. That's what the bill is all about. There's hospitals, and then there's levels of care below that. But this is, again, the highest level, and that's what this bill does. So the 24 beds, I don't think there's any question that we will keep those beds full. But it's not, with maybe hundreds of kids that are assessed throughout the year. Remember, this is the highest acuity kids. And during this whole conversation, from when we began, when we came up with this idea, Central State was the location that we looked at because the availability of staff, mental health professionals to staff it. So that has been the conversation from the beginning on this. And if the cabinet comes up with a more suitable location, I would understand that and support that. But that's due to the availability of mental health professionals. That's why we chose that location, why we have, over the last 3 years, that's where we have talked about the location being. I'll stop there, Mr. Chairman.
Thank you, Senator. Senator Thomas.
Senator Carroll, I was actually talking about this issue yesterday with several of our colleagues, and let me give you a scenario in which we were discussing this, and you tell me whether this high acuity mental hospital would be an option, or whether there would be some more severe options facing this student. There's a 14-year-old boy in high school, and during a disciplinary confrontation with a teacher, and he's bigger than a teacher, he hauls off and hits the teacher with his fist, severely injuring her. Okay. What happens to that 14-year-old boy? Does he just go through juvenile court and get a slap on the wrist? Is he expelled from school from a year? Is he tried as an adult and goes to adult prison? Or is this an option for him? How does your bill impact that situation?
This bill strictly impacts the situation if that young man was determined to be mentally ill, acutely mentally ill, and needed placement in a treatment center. As far as the crime itself, if the injury is that severe, it could be a second-degree assault. At the other option would be a third-degree assault if the injury was not that severe, and it would be brought. The young man would be brought into the system and follow the system. As it stands, there, even in a second or third degree assault, that young man would not be tried as an adult. The law does not allow that.
Mr. Secretary, Madam Commissioner, do you want to weigh in on this?
I agree with Senator Carroll. This facility is for those youth who are severely mentally ill. They have to be clinically assessed by a professional and that determination made before they would be eligible to go into the facility.
Thank you.
So there is, and I know another committee member expressed some concern. This sets up the process for that. So there is a mental health assessment, and then a representative from both cabinets would get together and decide whether or not they agree with that assessment, and they would file affidavits with the judge, and the judge would make the final decision on where the placement would be. So this is in no way intended to not allow offenders to be held accountable. These are mentally ill, severely mentally ill kids that we're talking about, and they need to be in that treatment. And if we do not start dealing with these issues while they're young, it's just going to continue on to adulthood, and eventually some of these kids are going to be out walking our streets, and we've all heard of the problems that has caused. So the younger we can get them the treatment they need, the better chance we're going to have of making sure those kids are successful and are able to function daily out in the public.
Senator Wheeler.
Thank you, Mr. Chair, and I apologize if this was answered during the first part of your presentation. As citizen legislators, sometimes life goes on outside the committee room, and I had to be in Zoom court at 9 o'clock. I guess, I understand the concept of wanting to help these children. I really do. But I guess what I'm trying to figure out, if these people are violent, we're talking as far as mental illness, worst of the worst, it sounds like. What is fundamentally going to be the difference putting them in this facility? Are you not going to have to isolate them in there as well for the protection of the staff? If you if you essentially concentrate a group of extremely violent people together, do you not run the risk of having even more violent confrontations? Are we not just taking them from one cell to another location with another cell where they're going to be in isolation?
I think the best comparison is looking at our state mental health hospitals. Do we put those folks in prisons? No, we don't. They're in state mental health hospitals. And with these kids, this facility will be designed to address those issues. And that's the whole point of it, is to have adequate training for the detention guard, security guard, juvenile detention guard, whatever title we have given them, where they would have the training, and that would allow the mental health care to take place. So it would be just like in a state hospital where they have security there, and the emphasis is on treatment. And this would create the best environment for that treatment to be successful, where in a juvenile detention center, that environment is not conducive to that, as we have learned the hard way over the recent years.
Mr. Chair, if you indulge me with a brief follow-up. In the current juvenile justice model, are you not able to give medications and things like that for treatment? I guess that's another thing. Is there any type of clinical care under the current model that the Department of Juvenile Justice is able to provide?
I'm going to ask Dr. Lester to step up and answer that question.
Dr. Lester is a child psychiatrist with UK, but also the chief medical officer for DJJ, and he can answer your question.
Doctor, if you could just identify yourself for the record.
Yes, my name is Dr. Clark Lester, and to answer that question, the current capabilities within DJJ, excuse me, we're able to provide oral psychiatric medication if the youth is willing to take that. A lot of the youth that we're talking about have such significant mental illness that they are not complying with treatment. So what would happen in a typical psychiatric hospital if a youth becomes aggressive, clearly psychotic? Then we would have nursing staff and the physician would order psychiatric, like antipsychotic medications to be administered immediately at that time because we're addressing that acute risk. And we are also providing treatment when we're administering those medications. In DJJ's current system, we are not able to give intramuscular injections. And so our staff are not trained to do the kind of physical holds that, and to administer that kind of treatment.
I think that does kind of answer my question. So right now you are not able to give, like if you have to give an intravenous sedative, that is not possible in the current DJJ environment.
That's correct.
Okay, that makes sense to me. You know, as far as what the census or the ratio of staff to patient, do we know what kind of that's going to consist of, and frankly, how much that's going to cost?
Senator Wheeler, we would obviously want to hire staff to juvenile ratio in such a facility because of the potential behavior, but also for the treatment modality. I think
Pull your microphone just a little closer. I'm sorry to interrupt you.
Thank you. We've yet to establish a staffing pattern, but there's patterns out there, and what it does suggest is that this is a very specialized population which is in need of a higher frequency of staff, whether it's frontline security staff or it's treatment staff. We don't have those specific numbers yet that's on hand, but we know that it's going to be a higher number.
I mean, but do you have an idea of what the overall cost is going to be through this program?
We've got an overall cost, like an operating budget is what you're specifically asking for annually. I think we've got an idea of an operating budget, and I can ask Rebecca Norton to step up and to answer that question with specifics for you.
Rebecca is the executive budget director for the cabinet, and she can provide you that information.
That's okay. So for the high acuity facility, our estimate for operating, of course, this wouldn't take place until after the facility is completed and constructed. But right now we're estimating about $12 million for operating costs annually. And keeping in mind that just a detention facility for juveniles that are not high acuity, not receiving, the specialized mental health treatment, you're looking at an estimated cost of about $8 million. That for staffing, just day-to-day operations. So the difference there is the high acuity treatment. Right now, the hard part that we can't really predict at this point in time is what would maybe be recouped through offsets from Medicaid for the medical care. So we're estimating just based on if we were paying essentially a contracted provider for that additional medical care and what that additional cost would be. So unfortunately, we don't have an exact number at this point, but I think that hopefully that helps to give you a better idea.
So through a civil commitment type process, this would enable them to be eligible for Medicaid and thus reduce the state costs.
Yes, that would be the goal,
That makes sense.
and that's kind of how the facility would be designed and constructed, would be keeping that goal in mind.
All right. Thank you very much, Mr. Chair.
Senator Deneen.
Thank you, Mr. Chairman. I believe Senator Wheeler hit on a lot of my questions dealing with finance and how much this might run with staffing. I did have one small question left. Time frame of which you anticipate construction, building, and what are your goals as far as when do you think this type of facility would be actually implement, so we could implement this program?
Obviously, during the construction phase, we would want to have a thorough design and build out process, because we in Kentucky, we would want to establish that this is a specialized type of design where we gear the physical plant towards treatment, towards well-being, towards mental health, but at the same time to balance that with a very secure facility. So we would have a build-out process and a design phase. I'm thinking that if funding is received and we receive authorization, it would probably take in the time frame of 2.5 to 3 years to build it out. But of course, that depends on the construction and the contractor that's willing to work with us, and availability of materials. We all know what's going on now.
Thank you.
I have just a few questions. Number one, I was on part of that working group that Senator Carroll talked about, and I thank him for his good work in still being the captain of this ship, and thank you for your good work on this. We also had an investigation, as I think someone mentioned over here, by the Investigative Oversight Committee during that period of time, and we looked at all these situations with these youth in these facilities, so I think this is a very needed piece of legislation. Also, I think, if I'm not mistaken, you presented this bill at least once last session in this committee, twice to the Juvenile Justice Oversight Committee. You've also presented it to the Interim Joint Committee on Judiciary, at least one time to the Budget Review Subcommittee on Judiciary. So in today's testimony, I think that's at least 6 times that I can recall this legislation being talked about. Is that basically accurate, Senator?
That is correct.
And we talked just last week through Juvenile Justice Oversight Council on the initial bill. I want to turn your attention to line 24 on page 1. There was quite a bit of conversation about that last week, and I think it's very important, since that was a televised committee, that we clarify the changes you've made in the sub to address that very issue, which again I think is critically important. So if you could just outline for the public who may be tuning in today what you've done there on line 24 on page 1 of the sub.
Basically, it clarified, it more made a broader statement to make sure that any situation with a child who is charged with a public offense are subject to a court order to receive inpatient psychiatric treatment pursuant to the Kentucky Unified Juvenile Code. And that's the key to that additional language, it kind of all-encompassing in those situations.
So, well, thank you for that clarification. Again, I think that was very important language cleanup. At this time, seeing no other questions, I'd entertain a motion on the bill. We have a motion from Senator Wheeler. We have a second from Senator Neal. Mr. Secretary, please call the roll.
Senator Carroll.
Aye.
Senator Deneen. Senator Neal. Senator Nemus.
Aye.
Senator Reed. Senator Stivers. Senator Thomas. Senator Wheeler.
Aye.
Chair Storm.
Aye. With eight yes votes, 0 no votes, and 0 pass votes, Senate Bill 125 is amended by the committee substitute is passed and will be reported favorably with the expression same should pass. Thank you, Senator.
Thank you, Mr. Chairman and committee.
As we turn next to our agenda, and those folks leave the table, we have Senate Joint Resolution 74. At this time, is Abby Gilbert in the room? Do you want to come up to the table? You're welcome to if you want to. You don't have to if you don't want to. Okay. You can be on standby in case there's any questions. So I'm just going to stay here at this time. And members, Senate Joint Resolution 74 is a joint resolution directing the Legislative Research Commission and state agencies to collaborate and create a statewide fiscal map of substance use disorder programs and funding sources, which I sponsored. And, basically the overview is this. Right now we're in a budget cycle, and numerous individuals and entities are coming before all of our, before this body, requesting various levels of funding. And some of these programs are excellent programs, and I think they're doing excellent work. And we want to make sure that those individuals are being properly mapped. And then there's some that may not be fitting that mold. And again, we want to make sure that we're mapping this. Kentucky invests hundreds of millions of dollars annually across multiple cabinets: health, justice, education, labor. The funding comes from various federal, state, and local sources with no centralized mechanism to coordinate or evaluate how these streams work together. Agencies often track their own data in silos, making it difficult to see the full landscape or identify service gaps and duplications. Why I believe this is necessary is because it provides a unified picture of where resources flow to improve policy, design, and budgeting. It establishes a baseline for measuring outcomes and ensuring the effective use of taxpayer dollars to ensure resources are directed where they are most needed. For the first time, we'll have an inventory of all substance use disorder programs in one place. Right now, it's kind of a hodgepodge, and what we want to do is, with this piece of legislation, is create this fiscal map. The report can be used to highlight where needs are unmet and where services are redundant. A public-facing report ensures that taxpayers and families affected by the opioid crisis can see exactly how the state is responding. So right now, we're currently operating without a full picture, but this resolution provides the initial framework that allows us to transition from siloed spending to data-driven, whole-person recovery models. This resolution doesn't just track spending, it creates statewide alignment framework to help Kentucky build the most efficient, transparent, and effective recovery system. Do we have any questions?
Just a comment, if you permit.
Yes.
Senator, I think this is a very good idea. Clearly we spend a lot of money on these types of programs, and I think that a map as far as recidivism and the effectiveness of these types of programs is very much needed so that we can make more targeted investments towards what actually works, what doesn't work, where we're throwing precious taxpayer dollars at programs that perhaps we're not getting our bang for our buck out of. So I think this is a very good idea. We need as we move forward on these types of programs. So thank you.
Absolutely. Seeing no further questions or comments, do we have a motion on the bill?
Motion.
Second.
We have several motions and several seconds. Mr. Secretary, please call the roll.
Senator Carroll.
Aye.
Senator Deneen.
Aye.
Senator Neal. Senator Nemus.
Aye.
Senator Reed. Senator Stivers. Senator Thomas. Senator Wheeler. Chair Storm.
Aye. With 8 yes votes, no votes, and 0 pass votes, Senate Joint Resolution 74 is passed and will be reported favorably with the expression same should pass. Thank you all. And Senator Carroll has a comment.
Mr. Chairman, this would something I need to clarify, something I said earlier where I misspoke. Those who are mentally ill who commit crimes as adults would be housed in prisons, but they would be housed in separate units where they can get the care that they need. Those who would be sent to the prisons, that's where they would receive their treatment. And I misspoke saying that they would be in state hospitals.
Thank you for the clarification. Seeing nothing else on our agenda, we are adjourned. Thank you.